To start our town hall presentations, I'm honored to welcome Rear Admiral Michael Weahkee, the Director of the Indian Health Service. Due to his schedule, Rear Admiral Weahkee recorded his message ahead of time to share with us today. In addition to providing his insights, he will also be responding to two questions that were previously submitted by two tribal leaders. And now we'll hear from Rear Admiral Michael Weahkee.
Good morning, everyone. I'd like to thank the Intertribal Council of Arizona and Blue Cross Blue Shield of Arizona for hosting this Tribal Health Town Hall. The IHS remains committed to strengthening partnerships with tribes, tribal organizations, and urban Indian organizations, and to working collectively to respond to and recover from the COVID-19 pandemic in Indian country. The partnership between IHS and the Intertribal Council of Arizona is a great example of the cooperation required to address the healthcare needs of American Indians and Alaska Natives. Continuing these partnerships will only build on the success and progress we're making in providing quality care to our patients. That's why it's fitting that the theme for today's Tribal Health Town Hall is standing together during the COVID-19 pandemic. IHS has worked closely with federal, tribal, and local governments and with tribal and urban Indian organizations throughout the pandemic response. Standing together during this time is more important than ever before. As cases of COVID-19 continue to rise, we must renew our sense of personal accountability to protect ourselves and those around us. With colder weather and more people staying indoors, we find that pandemic fatigue has been setting in. In order to stop the spread, we must think about alternative ways to stay connected with our friends and loved ones this holiday season. Travel increases your chance of getting and spreading COVID-19. Staying home is the best way to protect yourself and others. Our goal is to slow the spread, decrease hospitalizations, and decrease fatalities while keeping the economy open. The IHS continues to enhance our testing capabilities. For example, as part of the efforts by the Department of Health and Human Services to improve testing access for the most vulnerable segments of the population, the IHS has received and distributed over 300,000 Abbott BinaxNOW rapid point-of-care COVID-19 tests. These tests support the IHS's efforts in tribal communities where there have been recent increases in new cases and hospitalizations related to the ongoing outbreak. Overall, more than 1.36 million COVID-19 tests have been conducted throughout the Indian health system of care, which is equivalent to approximately 82% of the IHS user population, and it exceeds the overall U.S. general testing rate of 57%. With regards to a potential COVID-19 vaccine, we recently released the IHS COVID-19 pandemic vaccine plan. As we get closer to an FDA-approved vaccine, this plan details how the IHS healthcare system will prepare for and operationalize the vaccine. It also provides important guidance for all IHS federal, tribal health programs, and urban Indian organizations that choose to receive a COVID-19 vaccine coordinated through the Indian Health Service. The IHS National Supply Service Center has a long and successful history of coordinating and managing the distribution of pharmaceuticals, medical, and other healthcare-related supply items to our ITU programs nationwide. In addition to the COVID-19 tests that I mentioned earlier, the IHS Supply Service Center has distributed 78 million units of personal protective equipment and over 2,100 vials of remdesivir and 1,800 doses of bamlanivimab throughout the Indian healthcare system. To enhance patient care during COVID-19, the IHS formed a critical care response team composed of expert physicians, registered nurses, and other healthcare professionals that can provide urgent life-saving medical care to COVID-19 patients admitted to our IHS federal or tribal hospitals on an as-needed basis. I want to acknowledge this team for their hard work and response efforts that have helped to make a huge difference throughout the Indian health system. To date, the team has deployed to 11 tribal and federal sites, including to the Cells Hospital there in Arizona. They've helped to expand capacity to treat our patients and also train our frontline healthcare professionals on the most current clinical information available to help manage COVID-19 and other critically ill patients. Before I close, I'd like to remind everyone that with flu season upon us, it's important to protect yourselves, your family, and your communities by getting an annual flu shot. It's especially important during the COVID-19 pandemic to reduce the overall disease burden, as well as any unnecessary stress on the healthcare system by decreasing hospitalizations and reducing influenza diagnostic testing demand. I appreciate all the work that all of you do to promote Native health and your continued dedication to supporting the IHS mission of raising the physical, mental, social, and spiritual health of American Indians and Alaska Natives to the highest level. Again, thank you for this opportunity to provide remarks here today. Please stay safe and continue to take responsible actions to stop the spread of COVID-19 by following the 3 W's. Wear a mask, wash your hands, and watch your distance. With that, I'll turn it back over to our moderator. Thank you.
We have a few questions. We thank Admiral Weahkee, and we do have a few questions that are on the screen now that Admiral Weahkee will be responding to. And so I believe you can see them on your screen.
COVID-19 is still a relatively new disease, and there's a limited information regarding risk factors for severe disease. Based on currently available information and clinical expertise, older adults and people of any age who have serious underlying medical conditions might be at a higher risk for severe illness from COVID-19. These conditions include chronic lung disease or moderate to severe asthma, serious heart conditions, and people with diabetes. We do know that there are a number of challenges that we face in delivering healthcare, especially at facilities that are located in some of the most rural and remote locations in our country. The COVID-19 pandemic has been especially challenging, and it's not uncommon for our patients to have to travel 3 or 4 hours by car to receive healthcare. Our goal is to ensure that comprehensive, culturally acceptable personal and public health services are available and accessible to all American Indian and Alaska Native people. Also, our patients often live in multi-generational homes and are overall a very close-knit community. Large gatherings are a part of our lives, and so when a highly transmissible infection moves in, it circulates even faster. A recent CDC Morbidity and Mortality Weekly Report included data from the Hopi tribe that showed that frequent and recurring social interactions among extended family members permitted repeated exposures to infectious persons. In communities with similar extended family interaction, emphasizing safe ways to stay in touch, together with wearing a mask, frequent hand washing, and physical distancing, might help to limit the spread of disease. Another way to continue improving overall health of American Indian and Alaska Natives with regards to long-term outcomes is through the IHS Special Diabetes Program for Indians. Congress established the SDPI in 1997 to provide grants for diabetes treatment and prevention services for IHS federal, tribal, and urban Indian health programs across the country. There are currently 301 SDPI grant program sites in 35 states across all 12 of our IHS areas, who collectively are serving more than 780,000 people. These programs continue to successfully implement evidence-based and community-driven strategies to prevent and treat diabetes. For the first time, diabetes prevalence in American Indian and Alaska Native adults has decreased and has done so consistently for 4 years, dropping from 15.4% in 2013 to 14.6% in 2017. Neither the general United States population nor any other U.S. racial or ethnic group has shown a decrease in prevalence. Given that diabetes-related mortality has also decreased, this improvement in prevalence appears to be driven by a reduction in new cases of diabetes in Native adults. These improvements have huge implications for quality of life and healthcare costs. Sustained efforts in diabetes prevention and treatment are critical to ensuring continued advances in the health of Native people. The SDPI has been and continues to be key to this remarkable progress.
Our second question for Rear Admiral Weahkee.
As has been true across the entire healthcare industry, the COVID-19 pandemic has precipitated a very significant expansion of the use of telemedicine technology to provide services in Indian country. In April of this year, IHS announced the expansion of telehealth services during the COVID-19 response to ensure that our frontline IHS providers responding to COVID-19 have maximum flexibility to provide the care that patients need. Telehealth services means that patients can stay at home and reduce the risk of infection, while also keeping healthcare workers and others in waiting rooms and emergency departments safe from COVID-19. Telehealth also gives providers access to services from locations other than hospitals and clinics, as in the case of self-quarantine clinicians. Providers can continue to practice medicine and remain available for their patients, and they can also consult with their colleagues across the Indian health system. IHS facilities rapidly ramped up virtual care services from a pre-COVID average of about 530 visits per month to well over 33,000 visits per month between the months of April and July. This represents a 63-fold increase. Between 75 to 80% of these encounters have been conducted using telephone only, and we do not yet have data on the specific range of services covered, but the scope is broad. As reported by one IHS provider, the public health emergency transformed telehealth from an optional service delivery modality to an absolute necessity practically overnight. The conditions identified as risk factors for COVID-19 were essentially a bulleted list of our everyday patient profile. Telehealth has allowed us to continue taking care of our patients without increasing their risk of exposure. Not only have we been able to maintain patient care, but we've drastically improved access and expanded our scope of services. The organizational capacity of telehealth prior to the public health emergency at that provider's facility was approximately 3 to 4 departments engaged. They now support approximately 21 departments that offer telehealth services. A large portion of our patient population is located in some of the most remote and rural locations across the United States, so telehealth is our opportunity to close that gap. IHS has found telephone calls with patients to be very valuable both prior to and during the pandemic. Phone communications are critical to support patients located in bandwidth-constrained environments of Indian country where direct-to-home video consultation may not be possible. The IHS has always used telephone as a modality to support patient care and will continue to do so after COVID-19.
Our thanks to Rear Admiral Weahkee. We appreciate his service and dedication to tribes across the United States, and we thank him for taking the time to record this message with his busy, hectic schedule that he has right now and to be able to join us this morning.